Before bed, one bite of fruit can either take pressure off your kidneys or quietly make them work overtime all night. Many older adults feel a little hungry at night, or feel their mouth is dry, or just want something sweet before sleep. So they reach for a banana, a glass of orange juice, or a handful of dried raisins, and they think they are making a healthy choice. But this is where the danger begins. Not all fruits are equally friendly to your kidneys, especially before bedtime. What your kidneys fear most is not fruit itself, but the wrong fruit, the wrong amount, and the wrong timing. For people with aging kidneys, 3 things are especially dangerous at night. First, blood sugar quietly rising while you sleep. Second, potassium building up in the blood. Third, water and sodium balance getting disturbed, making you wake up again and again to urinate, then wake up the next morning with puffy eyes, swollen ankles, and unstable blood pressure. You may think you only ate a little fruit, but your kidneys may have spent the whole night cleaning up the mess. So please listen carefully, especially if you already have high blood pressure, diabetes, high uric acid, foamy urine, frequent nighttime urination, elevated creatinine, lower eGFR, or if your doctor has ever told you that your kidney function is not ideal. Let me say the most important thing first. Fruit cannot repair kidneys that are already damaged. Fruit cannot replace blood pressure medication, diabetes medication, water pills, kidney treatment, or regular follow-up with your doctor. The real kidney-friendly way to eat fruit before bed is to use the right fruit in the right portion to replace cookies, salty snacks, sugary drinks, instant noodles, late-night meals, and random supplements. That way, your kidneys face less salt, less blood sugar shock, less potassium risk, and less nighttime metabolic stress. Once you understand this, eating fruit before bed is no longer random. It becomes selective, controlled, and smart. Your kidneys are like a 24-hour filtering station inside your body. Everything you eat during the day, salt, sugar, protein, water, and minerals, eventually has to be regulated through the kidneys. They help remove waste, balance fluids, control sodium and potassium, and work closely with your blood pressure system. When you are younger, your kidneys have a lot of backup power. You may eat carelessly once or twice, and your body can still handle it. But as you get older, kidney filtration naturally tends to decline. Add high blood pressure, diabetes, and hardening of the arteries, and your kidneys become like an old machine that has already worked all day. If you push a large amount of sugar, potassium, and fluid into that machine at night, it may not rest easily. So the key to fruit before bed is not more nourishment. The key is more stability. Stable blood sugar, stable potassium, stable nighttime urination, and stable blood pressure. Many people think kidney health means detoxing. That is a big misunderstanding. Your kidneys do not need a magic fruit to detox them. Your kidneys need you to stop adding unnecessary burden day after day. Starting tonight, remember this rule. Fruit before bed should not be eaten like a big daytime fruit platter. Bedtime is not the time to eat a large amount. It is not your last chance to make up for nutrition. The best timing is about 1 to 2 hours before sleep. The portion should be small. Eat whole fruit, not fruit juice. Do not eat dried fruit. Do not eat canned fruit in syrup. Do not dip fruit in honey. Do not add salt. Do not mix it with sweet yogurt. Do not blend it into a giant smoothie. Once fruit becomes juice, much of the fiber is lost, sugar enters faster, and blood sugar can rise more sharply. Once fruit becomes dried fruit, the size shrinks, but the sugar and potassium become concentrated. A small handful of raisins may look harmless, but for older adults with kidney disease or diabetes, it can be much more troublesome than it looks. The first fruit that is often a better bedtime choice for many older adults is the apple. Apples are not magical, but they are stable. They are not extremely high in potassium, and they contain helpful fiber, especially when eaten with the skin. A whole apple also gives more fullness than juice. If you often crave cookies, cake, bread, salty peanuts, or late-night snacks, half an apple or one small apple is usually a much better choice. Why can apples be more kidney-friendly? Not because they cleanse the kidneys, but because they help you avoid foods that are harder on the kidneys. A pack of salty crackers before bed may add sodium burden. A bowl of sweet dessert soup may add blood sugar burden. A sugary drink may make your morning blood sugar worse. The pectin and fiber in apples can slow sugar absorption and support bowel regularity. This matters a lot for older adults. Constipation can make people strain, blood pressure can fluctuate, sleep can worsen, and long-term unstable blood pressure can damage the kidneys. The best way to eat apples before bed is not to eat 2 large apples. It is not to drink apple juice. It is half an apple or 1 small apple, eaten slowly, ideally about 1 hour before bed. If your teeth are not strong, slice it thin or make plain, unsweetened apple mash. But do not turn it into a sweet apple soup and do not buy bottled apple juice. If you have diabetes, be more careful. Watch your fasting blood sugar the next morning. If eating apple at night clearly raises your morning blood sugar, your body may not tolerate that timing well. Reduce the portion or move fruit to earlier in the day. The second good option is berries, such as blueberries, strawberries, blackberries, and raspberries. Many older adults are not used to eating berries. They may feel berries are not as familiar as bananas or oranges, but from a kidney-friendly point of view, berries have one big advantage. They are easier to portion, their sugar load can be gentler, and they contain anthocyanins and polyphenols. Do not misunderstand antioxidants as something that reverses aging overnight. Their real value is that they may support the body against long-term oxidative stress and chronic inflammation. The kidneys are full of tiny blood vessels. What hurts them most over time is high blood sugar, high blood pressure, and abnormal cholesterol damaging those tiny vessels. Berries cannot directly repair blood vessels. But as a small bedtime snack, they are usually much better than sweet desserts. The best way is about half a cup, just a small handful, washed and eaten plain. Unsweetened frozen blueberries are also fine. But berry yogurt, berry jam, berry drinks, and berry-flavored snacks are not the same thing. They may contain a lot of added sugar. At that point, you are not protecting your kidneys. You are feeding your blood sugar. Strawberries are the same. The healthy choice is fresh strawberries, not strawberry cake, not strawberry milkshake, and not strawberry cookies. For people with chronic kidney disease, many berries are often considered relatively lower potassium choices, but that does not mean unlimited portions. Kidney nutrition advice always comes back to portion size. A low potassium food can become a potassium burden if you eat a huge bowl of it. Many people do not get into trouble because one fruit is absolutely bad. They get into trouble because they have no portion control. Half a cup is fruit. A large basin is a burden. The third fruit to consider is red grapes, but the key word is small, not a whole bunch. Red grapes contain polyphenols and compounds often discussed in relation to blood vessel health and antioxidant effects. Your kidneys depend heavily on healthy blood flow. Your blood vessels, blood pressure, blood sugar, and cholesterol all affect the future of your kidneys. But grapes have one problem. They are extremely easy to overeat. Many people eat them while watching television, one after another, without realizing how much sugar they have taken in. If you do this before bed, your morning blood sugar may look worse, and nighttime thirst may increase. The better amount is about 10 to 15 grapes. Wash them, sit down, and eat slowly. Do not eat them mindlessly while scrolling on your phone. Whole red grapes are better than grape juice because the skin and fiber slow absorption. Grape juice, grape drinks, and concentrated juice are a different story. If you have diabetes, be careful with grapes because they taste sweet and can affect blood sugar. If your kidney function has already declined or your doctor has told you to limit potassium, grapes must be counted as part of your total daily fruit portion, not added as an extra nighttime treat. What the kidneys fear most is when you think healthy foods do not need limits. The healthier a food sounds, the easier it is to overeat. The fourth fruit that can work for many older adults is the pear. Pears are refreshing, contain plenty of water, and also provide fiber. Many older adults feel dry mouth at night, but they do not want to drink too much water because they worry about waking up to urinate. In that situation, a few slices of pear may feel better than drinking a large glass of water. But let us be clear. Pears are not water pills. Pears are not kidney cleansing medicine. Their advantage is that they can replace irritating snacks, provide a little fluid and fiber, and give your mouth something gentle before bed. The best portion is half a small pear, or a few slices, finished about 1 hour before sleep. Do not eat canned pears in syrup. Do not drink pear-flavored sweet drinks. Do not stew pears with a lot of honey, rock sugar, or syrup. Many people hear that pears are healthy, then turn them into a dessert soup. That defeats the purpose. Kidney health is strongly connected to blood sugar. Long-term high blood sugar damages the tiny filtering vessels in the kidneys. Diabetic kidney disease is one of the major reasons older adults progress toward kidney failure. If you truly want to protect your kidneys, respect your blood sugar, not just your taste buds. Also remember this: if you already have frequent nighttime urination, prostate problems, heart failure, or obvious swelling, even fruit with high water content should be controlled at night. Even a gentle fruit like pear can make you wake up more often if you eat too much. Broken sleep can disturb blood pressure and blood sugar. Kidney health is not isolated. It is tied to sleep, blood pressure, glucose, and body weight. If your sleep is poor, your kidneys do not get an easy night either. The fifth fruit is pineapple. Many people think of oranges and orange juice when they hear vitamin C. But for people who need to watch potassium, oranges and orange juice may not be the best bedtime choice. Pineapple is often listed as a more kidney-friendly, lower potassium fruit option when the portion is controlled. Its flavor is strong, so a small amount can feel satisfying. It is less likely to be eaten in huge watery portions like watermelon, and it is not as potassium-heavy as banana. Pineapple also contains bromelain-related compounds, which are often discussed in relation to digestion and inflammation. But do not turn this into a miracle claim. Pineapple is not an anti-inflammatory drug. It does not repair the kidneys. The reason it can be a better bedtime fruit is simple. In small portions, it has a strong taste, the potassium load can be easier to manage, and it can replace dessert. The right amount is about half a cup of small pieces. Do not eat canned pineapple in syrup. Do not drink pineapple juice. Do not eat sweetened, dried pineapple. If you have acid reflux, stomach ulcers, or often feel heartburn at night, pineapple may irritate your stomach, so it may not be suitable before bed. Remember, kidney-friendly eating is not only about the kidneys. You must also consider your stomach, blood sugar, sleep, and medications. A fruit that works well for someone else may not work well for you. The sixth fruit that may help some older adults as a small bedtime snack is cherries. Cherries contain anthocyanins and polyphenols, and some studies discuss cherries in connection with uric acid and inflammation markers. Many older adults have kidney issues and uric acid problems at the same time. High uric acid, gout, kidney stones, and chronic kidney disease can be connected in complicated ways. Cherries cannot replace uric acid-lowering medication. They cannot cancel out seafood, beer, and heavy meals. But a small portion of cherries, instead of a high-sugar dessert, can be a better choice for some people. Before bed, remember 2 rules with cherries. First, do not drink cherry juice, especially concentrated sweet cherry juice. Second, do not eat a large bowl without stopping. About half a cup, or around 10 cherries, is already enough. If you have diabetes, check your blood sugar response. If your kidney function is reduced, count cherries as part of your total daily potassium and fruit intake. Also, many dried cherries, candied cherries, and canned cherries contain a lot of sugar. They are not kidney-friendly fruit snacks. The principle stays the same. Whole fruit, small portion, minimal processing. The 7th fruit to mention is cranberry. Cranberries are often linked with urinary tract health, but this is easy to misunderstand. Cranberries are not medicine for urinary tract infection. They are not medicine for kidney inflammation. Their value mainly comes from certain compounds that may affect how bacteria attach in the urinary tract. For older adults, repeated urinary tract infections should never be ignored. If infection moves upward, it can involve the kidneys, causing fever, back pain, and sometimes hospitalization. But the biggest trap with cranberry is sugar. Fresh cranberries are very sour. So many people do not like eating them plain. That is why most cranberry juice, cranberry drinks, and dried cranberries are heavily sweetened. You may think you are supporting your urinary tract, but you may actually be raising your blood sugar. If you use cranberry products, choose unsweetened or low-sugar options and keep the portion small. If you take blood thinners, such as warfarin, do not consume large amounts of cranberry products without asking your doctor, because food and medication can sometimes interact. By now, you can see the real pattern. The bedtime fruits that are often more kidney-friendly are not the most expensive fruits, not the sweetest fruits, and not the trendiest fruits. They are fruits that are easier to portion, less processed, relatively easier on potassium, and gentler on blood sugar when eaten in small amounts. Apples, berries, small amounts of red grapes, pears, pineapple, cherries, and unsweetened cranberry options may fit this idea for many people, but knowing what to eat is only half the story. You must also know which fruits require caution at bedtime. The first is banana. Banana is not a bad fruit. For many healthy people, it can be nutritious. But banana is relatively high in potassium. If your kidneys are normal, one banana may not be a problem. But if you have chronic kidney disease, high blood potassium, or you take certain blood pressure medications or potassium-sparing water pills, a banana before bed is a different situation. High potassium is not a small issue. It can affect the electrical activity of the heart. In serious cases, it can trigger dangerous heart rhythm problems. The second is orange and orange juice. Many older adults think orange juice gives vitamin C, so drinking a glass at night must be healthy, but orange juice can be higher in potassium and fast-absorbing sugar. It is not always suitable for older adults with kidney disease or diabetes. This does not mean everyone must avoid oranges forever. It means orange juice before bed is not automatically healthy. The third category is dried fruit, such as raisins, dates, dried figs, dried apricots, and prunes. They look natural, but they are concentrated sources of sugar and potassium. A handful before bed can be very unfriendly to people with kidney disease or diabetes. The fourth category includes avocado, cantaloupe, honeydew, and large amounts of watermelon. They all have nutrients, but for people who need to control potassium, water, or blood sugar, they are not casual bedtime choices. The fifth fruit deserves a special warning. Star fruit. People with kidney problems should avoid star fruit. It can contain substances that may cause serious nervous system symptoms in people with kidney disease, such as confusion, seizures, and other severe reactions. Many people do not know this. They see star fruit as refreshing and natural, but if your kidney function is not good, this is a risk not worth taking. Now, let us go deeper into the basic logic. Why is eating fruit in the morning different from eating fruit before bed? Because before sleep, your body begins to slow down. Your activity level drops. Your muscles use less glucose. Your stomach may empty more slowly. If you eat sugar that absorbs quickly, and you do not move afterward, your blood sugar the next morning may be higher. For people with diabetes, even a nighttime snack can affect morning glucose. That is why the type, timing, and portion matter. The kidneys hate long-term high blood sugar. High blood sugar is like fine sandpaper, rubbing against the tiny blood vessels inside the kidney filters every day. Over years, protein starts leaking into the urine, kidney function falls, and the eyes, nerves, and heart may also suffer. Many kidney problems do not appear overnight. They develop slowly after 10 or 20 years of poorly controlled blood pressure and blood sugar. So fruit before bed may look like a small habit, but it reflects whether you truly understand chronic disease management. The second issue is potassium. Potassium is not bad by itself. Your heart, muscles, and nerves all need it. But when kidney function declines, extra potassium may not be removed well, and it can build up in the blood. The problem is that high potassium may not give obvious warnings. It may cause weakness, palpitations, chest discomfort, or in some cases, sudden dangerous heart rhythm problems. This is why kidney diets often discuss bananas, oranges, potatoes, tomatoes, and salt substitutes. These foods are not evil. The issue is that damaged kidneys cannot handle potassium as well. One banana tonight may feel fine, but if you eat one every night, while also having reduced kidney function, blood pressure medications, dehydration, or an infection, the risk can rise. The third issue is fluid and nighttime urination. Many older adults eat fruit at night, especially watermelon, pears, or oranges, and they eat a large plate. Then they wake up 2 or 3 times to urinate. You may think this is just a bladder issue, but broken sleep can make blood pressure more unstable the next day. Poor sleep can lower daytime energy, reduce movement, worsen blood sugar, and create a cycle that hurts kidney health. The kidneys are connected to the whole body. Sleep, blood pressure, blood sugar, and weight all matter. The fourth issue is sodium. Fruit itself is naturally low in sodium, which is one reason it can be better than salty snacks. For many older adults, the most kidney-damaging bedtime habit is not fruit. It is pickles, salted peanuts, processed meat, instant noodles, crackers, and salty seeds. Too much sodium raises blood pressure, worsens swelling, and increases the filtering pressure inside the kidneys. If half an apple, a small handful of blueberries, or a few slices of pear helps you replace those salty, late-night snacks, that is a real kidney-friendly change. Here is a simple bedtime fruit formula you can use tonight. Step 1. Know your condition. Are you generally healthy, or do you already have chronic kidney disease, diabetes, high blood pressure, heart failure, swelling, protein in the urine, or abnormal blood potassium? A generally healthy older adult has more flexibility. A person with kidney disease needs much more caution. Step 2. Check the timing. Eat fruit 1 to 2 hours before bed, not right before lying down. Step 3. Check the portion. Keep it to 1 small serving. About half a cup of berries, half an apple, half a pear, 10 to 15 grapes, half a cup of pineapple, or around 10 cherries. Step 4. Check the form. Whole fruit only. No juice, no dried fruit, no candied fruit, no canned fruit and syrup. Step 5. Check your reaction. The next morning, notice whether your eyelids are puffy, whether your ankles are swollen, whether nighttime urination increased, whether you felt thirsty, whether your morning blood sugar rose, whether you had reflux, or whether you felt palpitations or weakness. If something changes, that fruit, that timing, or that portion may not be right for you. Step 6. Check your lab results. You cannot judge kidney health by feeling alone. You need creatinine, eGFR, urine albumin to creatinine ratio, blood potassium, urine tests, blood pressure, and blood sugar. Many older adults believe that as long as they can eat and sleep, their kidneys must be fine. That is a dangerous illusion. Early chronic kidney disease often has no obvious symptoms. By the time swelling, nausea, weakness, or major urine changes appear, the problem may already be advanced. I once saw an older patient who had eaten fruit before bed for decades. When he was younger and healthier, almost nothing caused trouble. Later, he developed diabetes and high blood pressure. His doctor told him his kidney function had started to decline, but he still believed fruit was always healthy, so he ate 1 banana every night before bed, and sometimes drank a glass of orange juice too. His daytime diet was not terrible, but his morning blood sugar stayed high, his ankles often swelled, and his nighttime urination became more frequent. Later, with guidance, he changed his bedtime habit. He stopped using banana and orange juice as his default nighttime snack. He switched to small portions of apple, blueberries, or a few slices of pear. He moved the snack earlier, controlled salt at dinner, and worked with his doctor on blood pressure and glucose. After a few weeks, the biggest change was not a miracle kidney reversal. It was fewer nighttime bathroom trips, less morning thirst, more stable glucose records, and less frequent ankle swelling. This story does not prove that one fruit is a miracle. It shows something more practical. When you reduce the wrong burden at night, your body may send fewer warning signals. Chronic disease management is not about one dramatic cure. It is about the small choices you repeat every night. So let us make the message simple. The fruits that are often more kidney-friendly before bed are low sodium, whole, small in portion, relatively easier on potassium, higher in fiber, and less likely to shock blood sugar when eaten carefully. Examples include apples, berries such as blueberries and strawberries, small amounts of red grapes, pears, pineapple, cherries, and unsweetened cranberry options. The fruits and fruit products that require more caution at bedtime include bananas, orange juice, dried fruits, candied fruits, large amounts of watermelon, avocado, cantaloupe, honeydew, and star fruit if kidney function is poor. Tonight, you can do 3 simple things. First, open your refrigerator and check which fruit you most often eat before bed. Second, reduce the portion to 1 small serving and stop eating from a large plate while watching television. Third, keep a 7-day record. Write down what fruit you ate, what time you ate it, how many times you woke up to urinate, whether your eyelids or ankles were swollen the next morning, and what your morning blood pressure and blood sugar looked like. After 7 days, you will understand your own body much better. At your next doctor visit, do not only ask whether you can eat fruit. Ask more specific questions. What is my eGFR? Is my blood potassium high? Do I have protein in